My child was hit by a car.
My child had a serious burn.
My grandson, he burned his hand.
From Wauchope to Port Macquarie, we travelled.
She required a skin graft. Being in a regional area, we just don't have the services and the specialists here.
We had to take him to Sydney Westmead Children's Hospital.
We live in Port Macquarie, so it's quite some distance.
I got a phone call from the Aboriginal Social Work for Burns Unit and wanted to organise our trip.
She arranged the little wings for us to be flown down from Port Macquarie to Bankstown.
It only took an hour, where it normally takes 5 hours in a car.
She'd arranged the transfer from Bankstown to Westmead.
On arrival there, I was rather stressed, not knowing what we were going to face.
We're away from family and home and our culture. From our mob, our people feel more secure if they see a friendly Aboriginal face in front of them.
We were shown to our bed and settled my child in. Then we had a Aboriginal health worker approach us.
That first contact, without a doubt, it really does make a difference. It means that I've got the ability to see how the parents are because, let's face it, parents or carers of children who have had a burn, there's a huge amount of guilt that comes with that. We know often the younger children are really curious, and that's one of the reasons why they end up in situations where they get hand burns or burns on their feet. And so we're able to diffuse the situation, let parents know we know it's an accident, everything's okay, and Kids Burns Unit do this every day.
Having the same Aboriginal health worker each time we arrived at the hospital, this was very important for my child. She was always looking for her, and I find that this makes a big difference with the healing.
When I went down for my grandson, the first appointment I went down, and then the third appointment I went down, I had that Aboriginal health worker there in front of me.
My child is still having physio now, so we're still required to go down regularly. This has been going on for over a year now. Every time we go down, we're seeing the same face. My child has been able to make that connection with the Aboriginal health worker. She feels safe, she feels comfortable, she's happy to see her again. They've formed a real bond.